AI in healthcare. Artificial intelligence is transforming our world, and nowhere is that transformation more profound than in healthcare. To understand how quickly things are changing, imagine this: the voice you're hearing right now, the face introducing this topic, and even the words on screen could all be generated by AI. That alone reveals the scale of disruption unfolding around us. But behind this digital introduction stands the human perspective that grounds today's story. Experts like Dr. Jonathan Chen, a physician and researcher who has spent decades studying how AI can expand access to care, and his journey reveals both the promise and the urgency of this moment. Yet the human problem AI is trying to solve. Dr. Chen describes a young patient who arrived in his clinic exhausted, with a racing heartbeat. He quickly recognized a thyroid imbalance and sent her to a specialist, only to learn the next available appointment was 3 months away. Instead of letting her wait, he used everything available: medical textbooks, digital references, even advice from a former classmate. The problem wasn't his knowledge, it was the system's limitations. This story illustrates a truth many clinicians know well. Modern medicine is too complex for any single person to fully master. Tens of thousands of diagnostic tests, treatments, and rapidly evolving research papers, no human mind can reliably track it all. That's the world AI is stepping into. Saya Toolkit's AI's rapid evolution and what it reveals about medicine. Just a few years ago, early models like GPT 3.5 barely passed basic medical exams. Today, GPT-4, MedPaLM 2, Med-Gemini, and the latest GPT systems outperform the average physician on standardized assessments. But multiple-choice questions tell only part of the story. When researchers gave AI the same complex open-ended exam taken by Stanford medical students, requiring diagnostic reasoning and written explanations, GPT 3.5 passed, and GPT-4 exceeded the student average by a wide margin. But something surprising happened next. In a randomized study, physicians were asked to solve challenging clinical cases, some with AI assistance, some without. Even though the model outperformed every human participant on its own, doctors using AI showed only small improvements. The lesson: the barrier isn't the technology, it's adoption, training, and trust. Can AI show empathy? The results may surprise you. Some clinicians argue that AI can never replicate human empathy. Yet in emotionally difficult scenarios, breaking bad news, guiding end-of-life discussions, handling ethical dilemmas, AI responses were often more thoughtful and emotionally attuned than expected. For Dr. Chen, the realization was uncomfortable at first, but also revealing. AI can offer a safe environment for clinicians to practice these conversations, strengthening the human skills that matter most. As one longtime saying goes, any doctor who can be replaced by a computer should be replaced by a computer. Often misunderstood, the message is not about replacing people, it's about clarifying what is and is not irreplaceable. AI won't replace physicians, but physicians who learn to use AI may replace those who do not. The timeline problem, the hidden complexity behind medical data. To understand why AI is so powerful in healthcare, we have to look at how medical data works. Healthcare isn't made of tidy spreadsheets, it's a timeline. Clinic visits, vital signs, imaging, lab results, genetics, medications, physician notes, hospitalization records, and all of this is scattered across hundreds of digital systems. No patient has everything measured at once. No clinician sees the full picture without digging. Most AI algorithms expect perfectly structured data, but healthcare is the opposite. And yet, when researchers treat this timeline as a language, a sequence of medical tokens similar to words, they can build advanced predictive models with far fewer examples. Suddenly, rare diseases and small datasets become solvable challenges. That's 3 levels, where AI changes medicine. According to experts, AI drives progress in 3 layers. 1. Advancing scientific knowledge. AI has identified new subtypes of diseases like heart failure, not previously visible to clinicians. 2. Improving clinical practice. These discoveries become useful only when tests and treatments exist to match them. 3. Transforming healthcare delivery. Health systems must then ensure these tools actually help patients at scale. One example: the green button. When a clinician needs guidance for a rare or complex case, medical literature may not help. The green button analyzes outcomes of similar patients within the health system and returns an evidence-based 2-page report, overnight instead of 9 months. Another example, predicting which patients may need advanced care planning in the next 3 to 12 months. AI identifies who is at risk so clinicians can initiate compassionate, timely conversations. Thousands of patients have benefited. The value isn't in prediction, it's in the actions these predictions enable. The rise of generative AI and its limitations. Generative AI tools like ChatGPT have sparked excitement, but healthcare must approach them cautiously. A review of over 500 studies showed serious evaluation flaws. Many used exam-style questions instead of real patient data. Few considered clinical utility. Some ignored cost and workflow constraints. Even high-performing models still make errors in summarizing charts or generating clinical reasoning. They can reduce cognitive load, for example, helping clinicians draft responses to patient messages, but they don't increase productivity because physicians still need to review every message. Efficiency improves, output does not. To build trust, we must measure real outcomes. Does it save time? Does it reduce errors? Does it improve care? Real-world impact, the story of open evidence. In Tennessee, oncologist Dr. Samyukta Mulangi sees up to 25 patients a day. Her nights often end in pajama time, finishing documentation long after her children go to bed. Across the US, nearly half of doctors report burnout. Meanwhile, medical knowledge now doubles every 73 days. A specialist would need 9 hours a day just to read 1/3 of the new research in their field. This overwhelming reality led economist-turned-founder Daniel Nadler to create Open Evidence, an AI system designed to help clinicians navigate medical literature. It understands clinical meaning, not just keywords, and retrieves high-quality, peer-reviewed evidence in seconds. Today, half of all US physicians use it. Another 65,000 join every month, and though the company is valued at $3.5 billion, its mission remains clear. AI does not diagnose. It helps doctors make better informed decisions. At Mount Sinai Health System, Dr. David Reich sees AI as part of a broader ecosystem, combining genetics, imaging, and electronic records to create deeply personalized care plans. The future he describes is one where your medical history, family risk, and genetic profile integrate into a single, coherent model that guides precision treatment. AI as a connector, not a replacement. Nadler envisions something even more human. An AI that acts like a wartime phone operator, instantly connecting clinicians facing rare cases with the right experts, anywhere in the country. In Dr. Mulangi's clinic, this future is already visible. Open Evidence returns minutes to her day, supports faster decisions, and reduces burnout, not by replacing her judgment, but by elevating it. This is AI making an impact, not in theory, but in practice. One physician at a time, one patient at a time. For new instrument in the history of medicine. On the wall of one researcher's office are 4 images: a transistor, a camera, a telephone, and the source code for the World Wide Web. Each represents a breakthrough that reshaped how we communicate and care for one another. AI now stands alongside them, not as a replacement for human compassion, but as a new instrument that amplifies the work of clinicians and reveals insights hidden in data. The question is no longer whether AI will transform healthcare. It already has. The real challenge and the opportunity is ensuring that this technology remains safe, responsible, equitable, and deeply human. Because at its core, medicine has always been about one thing: using every tool we have to care for people. And with AI, that toolkit is expanding faster than ever.